So hi, welcome, good morning. This is the Foundational Community Supports #2 training on the assessment process and prioritizing areas of need. It's the second of 6 trainings that will be happening over 6 consecutive Tuesdays. And my name is Shelley Bookbinder. I'm going to be facilitating today's training. And the other person, I'll be facilitating 3 of the 6 trainings. My colleague, Emily Bands, will be facilitating the other 3. You'll meet her next week. And our colleague, Francine Bates, will be on all of these calls assisting. So you can see Francine there. And I just ask that people mute, especially when they're coming in because for purposes of recording. So Emily and I and Francine are from the Rutgers School of Health Professions, the Department of Psychiatric Rehabilitation and Counseling Professions from the Garden State of New Jersey. We're currently 3 hours later, so if I accidentally use Eastern Standard Time, I apologize, but I'm going to try to stay in Pacific Standard Time. So we're being contracted by the Washington State Healthcare Authority, as I mentioned last week, in part because we have a similar fee-for-service program that covers supportive housing. So we do training and technical assistance for provider agencies in New Jersey. And we're going to move on to now some training basics, which you might recognize last week if you were with us, but we changed things a little bit. So in terms of audio and visual, this is a meeting. It's not a webinar because we wanted to have breakout groups and things like that. So you have control over audio and visual. We ask that you connect to audio for purposes of the breakout room so you're able to communicate with each other. But because this is a large training, we do ask that you keep your audio muted and communicate mainly with the chat. And that's just in order to keep down background noise and for the purposes of the recording. In terms of video, you are absolutely welcome to share your video. You have control over that. We do ask that you have appropriate dress, appropriate background, and appropriate behavior. We had some feedback last week that somebody anonymously saw some inappropriate behavior in the video that was being shared that neither Francine nor I saw. And so we want this to be a safe environment in the same way that you want safety for your clients, consumers. And so we're absolutely on the lookout for that. So please be mindful of other people's, people are coming from different experiences, things like that. And so we want to have a safe professional environment. And so Francine may mute your video if there's something, again, sometimes you might not be aware that you're sharing things. We're not sure if things are intentional, non-intentional. So if your video is muted, just there's something that was deemed to maybe be inappropriate if someone's moving around, things like that. So I just wanted to put that out there. And we absolutely love seeing people's faces. So please, feel free to share video, but at the same time, be mindful of the people that are on the call. And so if there's anything you see that's inappropriate, things like that, please feel free to either send a message afterwards or to chat Francine or myself, and we'll try our best to address it. So I need to put that in there. Again, we're going to ask you to ask and respond to questions via the chat. We do want this to be interactive, but again, because there are a number of people, currently about 70, we're going to keep things mostly to the chat. And this webinar is again being recorded. The presentation and the recording will be sent out by the Healthcare Authority of Washington State, hopefully sometime this week. So again, I'm going to give you a training series overview. Oh, I know what I wanted to do before I did this. I'm going to, if anybody's having difficulty with their audio, I'm sending the call-in information. Again, you're not going to need this for a while because it's going to be for the breakout room that happens later. But if you're worried that you're not able to connect to audio, you can call in to do that. And so that information is there in the chat. So a series overview, again, there are 6 consecutive Tuesdays that we'll be doing training from 9:30 to 11:30 Pacific Standard Time. This at one point prior to the pandemic was done in person over 2 full days. So we had to rearrange things and we hopefully broke things down in a way that makes sense, all following this idea of the golden thread. And so what we did last week, which I'll review in a moment, was we talked about what is the golden thread? How does it relate to a rehabilitation service like supportive housing or supported employment. What we're going to do today is talk about the assessment process, which is two-part in foundational community supports. There's a uniform assessment and then a comprehensive assessment that happens. So we're going to go through that process and then also talk about best practices in terms of assessment. Then next week, you're going to meet my colleague, Emily, who I've been talking up, and she's going to be talking about goal development and working through thinking about knowledge, skills, and resources and how to break down goals into manageable pieces for people to be able to make progress on and thinking about reasonable steps towards goal achievement. Then the following Tuesday, on the 24th, Emily will be talking more about goals and specifically thinking about how to make goals SMART and thinking about the importance of SMART and SMART goals, objectives, and services. Then I will be back for the 5th training on intervention development. We're going to talk a lot about skills teaching and then also resource development. And then I'm going to talk about some evidence-based practices that can be used to provide services in foundational community supports. That will be on the 1st of December. And then Emily will close things out by talking about providing intentional services, what that means, and then how to document those services and give some resources in terms of a format to be able to do that and some best practices. So I'm going to take a moment. Does anybody have any questions about the logistics, the timing, anything like that before I move on? So Amanda, I can see that you're in the car kind of looking over. I hope that you stay safe. So hi, thank you for the wave. So thank you for sharing your video. We're getting a view of scenic Washington. Okay, wonderful. So again, a little bit about myself. I introduced myself last week, so I'm not going to do as completely. Oh, somebody is asking about the contact form. Absolutely. So it was in the chat. So if you scroll up in the chat, but I'll also put it again. So this is the link for the optional contact form. And again, it's going to be unmoderated. So anybody who would like to fill it out, again, it's optional. If you just click on it, you can fill out the form and then it'll take you to the spreadsheet. So anybody who wants to fill that out, open it, save it for later. Again, unmoderated, completely optional, and to be in contact with other people in the training. Yeah, so Mike, I was planning on sending it at the end, absolutely, when I did the evaluation. That's a wonderful, wonderful suggestion. So I'll talk about the optional contact form again at the end. Thank you for the smiley face. I'm learning all of these. I'm very not tech up on emojis and things like that, but I'm having to be with using the chat more. So a little bit about myself again. So my name is Shelley Bookbinder, and I'm an education training specialist at the Rutgers School of Health Professions Department of Psychiatric Rehabilitation and Counseling Professions. I have a doctoral degree in environmental psychology, and prior to that, I worked as a social worker in a variety of settings, mainly in New York City. Currently, my position requires that I do a lot of trainings for our supportive housing program in New Jersey, which is also a Medicaid fee-for-service program, and I also offer technical assistance to those agencies. So while our programs are a little bit different, I'll point out some of those differences today. It's quite similar, which is why we've been contracted by your healthcare authority. So that's a little bit about me. It's kind of silly that I have this picture up since you can see me, but you know, a glamour shot. You can see in the back there's some skateboards with bedazzled skateboards with mosaics, which is why I had the image up. Yeah, so Mike wanting to know a little bit more about the history. So if you go back to the presentation, we didn't go into it so much, but we talked about that waiver 1115 for Washington State, and that's about transitioning certain programs. Some great links, maybe with their website. Yeah, so I think the idea of these Medicaid programs covering more mental health rehabilitation services and also for people with substance use disorder, Medicaid's been moving in this direction. But yeah, if you go back, definitely check out the waiver Washington 1115. If you go back to the presentation, there's definitely more information on that. Okay, so a quick review of what we talked about last Tuesday for those of you who weren't with us, and also just to refresh, I barely remember what happened yesterday, so a refresher is always good. So we talked about the golden thread of foundational community supports. I actually, based on a lot of you were taking pictures last week, and so I was like, I'm just going to make this into a standalone document to make things easier. I like to try to be responsive. This is the golden thread that we talked about last week. It goes from engagement, medical necessity, all the way through to the assessment, planning services, documenting services, and then tying everything back together. So that is the document on just one page, if it's helpful, if you didn't get it last week.
Shelley,
Yes.
all we see is the title. I don't know if other people see it, but we don't see the whole. Is everybody else seeing basically a blank slide?
You need to click on the link to get the document.
Yeah, I just opened it. The link should work, Francine.
Okay.
But thank you for checking. So, and thank you for whoever, I didn't see who unmuted. Thank you for unmuting. Okay, wonderful, Mike. I'm glad you could see it. So we talked about the golden thread specifically for two reasons. It's a Medicaid requirement, and Foundational Community Supports is a Medicaid fee-for-service program. It's necessary for prior authorization through Amira group, and also post-service for audit purposes. They're going to be looking that you follow this thread in terms of documentation and services. The other reason we covered is because it's a best practice for rehabilitative services, and supportive housing and supported employment are both rehabilitative services. And so they're individualized, person-focused, and collaborative, as we talked about last week. They're done, all the documentation can be seen by the person, and should have their input and needs to be signed off by them. So these are collaborative, individualized documents working towards people's goals, right? Not done in complete isolation, but again, in collaboration with staff. And these follow rehabilitative, these overarching rehabilitative goals we talked about, the idea of recovery, that people are trying to work towards independence and reformulating their aspirations in concert with issues around mental illness and substance use. Also how to integrate into communities and how to have an increased quality of life, both objectively in terms of maybe housing or employment, or also subjectively in terms of the things that they find joy and meaning in life. And these are often motivated by valued life roles. And so I asked last week if people could speak to consumers about valued life roles. And for any of you who spoke to consumers about valued life roles or have in the past, what did you learn by asking them? Did you learn something new about the person you were working with, if this was someone new? Was there anything challenging about asking about valued life roles? I mentioned an open-ended question, tell me about the things that bring you strength, meaning, joy. This, of course, could be adapted based on the person, your experience with them, but thinking about starting that conversation, was there something challenging about that? So people, if you want to put in the chat, I was just going to share an example while people are doing that. And did anyone disclose an unexpected valued life role? And while people are writing, during a training, somebody shared that a consumer took part in a cosplay community called furries. I don't know if people are aware of that. It's often it's anthropomorphizing animals into costumes. It's kind of a form of cosplay. People get really into it. They make friends. They go to, it's a real social community for people. And the person had never heard of that, right? And so she started to get resources and think about how she could connect people, connect the person and help them develop that interest, and how that might connect to perhaps, wanting to have some emotional wellness or thinking about financial wellness in order to do some of these things. And this kind of spiraled into a larger conversation about services. So some of these conversations you can find out, about communities you didn't know about, interests that you didn't know about. So it really is an opportunity for people to share things about themselves. So yeah. So did anybody have a conversation about valued life roles over the last week? Okay, well, we're going to give you these learning applications. I'm still going to wait to see if I see anything, but the goal is to give you an opportunity to try some of the things we talk about. We're going to talk about more concrete resources today. So just in general, we're going to ask. So Ashley, you had a client tell you that they value being accountable because they've never been accountable before. Wow, that's beautiful. And like thinking about this process is kind of checking in, saying things and having them be checked in. So there's a lot about this process that is making people accountable for the things that they've said that they want to do and then checking back in. So that's a wonderful way of thinking about the process of some of these services as a form of accountability. I really like that. So Mike, I learned that one of my clients used to be a famous chef in New York and would like to find people that enjoy cooking like he does. That's wonderful. So that's historical information, something that, you know, and especially if, you know, feeling like he hasn't been able to cook or had space to cook or support and stuff, and thinking about that vision of himself and wanting to translate that. Like we talked about recovery goals, he might not be a famous chef right again if he was that in New York, but thinking about how he can find spaces and community to cook and do something that he loves, maybe in a slightly different way. So that's really, thank you so much for sharing that. Very important, we're going to talk about it more in terms of the assessment today, but valued life roles are incredibly powerful for the purpose of understanding people's motivation, where they're coming from, a role of being a chef, a role of thinking about somebody as accountable, as oneself as accountable. These are things that are very motivating to people and quite individual. So now the learning objectives for today, we are again going to outline the assessment process. FCS is a two-part process of a uniform assessment and a comprehensive assessment. We'll go through that. We're also going to talk about best practices in terms of assessment. There's a pretty diverse assessment process, so I'm going to just talk about general things to keep in mind in terms of a rehabilitative assessment, focusing at the end on the 8 dimensions of wellness, and then we'll do some practice, giving an opportunity to use a tool that we're suggesting can be adapted or used in your programs if you think it's helpful, and we'll give you a learning application to use that over the next week. So today is all assessment. So this is, again, this golden thread. It's going to come up in every single training, and we're going to highlight what part of the golden thread we're focusing on. So since we're talking about assessment today, we're going to talk about medical necessity. That's mainly what the Amer group assessment, the uniform assessment, does. And then the comprehensive assessment focuses on strengths and needs and teasing out experiences, like the example of being a chef in New York. That's not something that would come out on a multiple choice or kind of fill in the blank or checkbox assessment, but more of a conversation. And then that comprehensive assessment works towards identifying personal goals, which next week we'll develop those even more. So that is where we are in the golden thread at the beginnings with assessment. So I'm going to open a poll. I would like to hear from all of you about your role in the assessment process. So this should be popping up now. Do you complete a foundational community support assessment? The Amer group assessment only, comprehensive, both, neither, unsure? The second question, if you complete the assessment, how confident do you feel completing the assessment? And then number 3, what do you hope to get out of this training? So if you can, again, take this poll, I'll share the results so you can see who else is in the room, what other people are doing. Wonderful. So we have a little of almost 60% of people have responded. So I'm going to give it like another 15 seconds. So if anybody else would like to respond to the survey, and then I'll share the results. Survey, it's a poll. Why am I saying survey? I was just doing something with the survey. My mind is in surveys. Okay, so 5, 4, 3, 2, 1. I'm going to end the polling and share the results. So about 25% of you only do the Amer group assessment, about 17% both assessments, a big chunk of people either do neither assessment or unsure. So hopefully we'll clarify that a little bit in terms of if you're doing them, what they are. And then only 8% of you only do a comprehensive assessment. Okay, so that's great to know in terms of what people are doing. If you complete the assessment, how confident do you feel? So about 25% very confident, 30% sometimes, and then 30% of the people who don't complete it, it's not applicable to you. And what do you hope to get out of today? Both information and skills for most of you. So we have information and a concrete thing to use. So you are absolutely in luck for those of you who would like both. Okay. So as I mentioned, to go into the information piece, foundational community supports both supportive housing and supported employment. So some of you have programs that do both. Some of you are in just one or the other, have a two-step process. The first step is the FCS Uniform Assessment. This is through Amer group, and there's a supportive housing assessment and a supported employment assessment. And a number of you mentioned that you do these assessments. So for those of you who don't, I'm going to put in the chat these assessments. So all the assessment forms in English and Spanish, but then specifically in English, the supported employment form and the supportive housing form. So for those of you who maybe are not as familiar, you can take a look at it. These forms are specifically for medical necessity. As I mentioned, because Medicaid is an insurance program, all its services are focused on medical necessity, and it requires, which I'll give you some examples in a moment, a health need and a risk factor. And so that's the necessity for services, and all services, if you follow the golden thread, will follow that medical necessity. And so this assessment, both of them are certified, and people can have one or both services if they qualify. These forms, as you see if you open them, they're mostly, what is your income for the example of supportive housing, what's your income, what's your current living situation, what are strengths, what are barriers, right? Mostly check boxes or things you can easily within ranges, right? So that's basically making sure that you qualify for services and having a little bit of information. So that's the first part of the process, and that's what's needed to enroll people, that medical necessity that you qualify for the program. And that goes to Amira group. The second part of the assessment is a comprehensive assessment, which is selected by the agency. This does not go to Amira group, right? This stays within the agency. And so when Amira group is reviewing for prior authorization, ISPs, individualized service plans, they're not looking at this. This is something that auditors will look at when they're looking for the golden thread, right? So this stays within the agency, and the agency selects it. So there's wide variation in terms of what's used. Does anybody know what type of comprehensive assessment your agency uses? Is there a special one for foundational community support, supportive housing, supportive employment? Is there one that's specific to, let's say, employment? It was mentioned by the healthcare authority that the career profile is used by some agencies, which is very employment specific. So what is used? Is it a standard biopsychosocial? Is it an intake? So I just want to get a sense of what people are using because there's so much variation. If you don't know, that's absolutely fine as well. But for those of you who are aware and do the comprehensive assessment, you use the career profile. Thanks, Ashley. You're with WISE, Shannon, and you use CANS. Harrison, the career profile. We heard from HCA that they're trying to push the career profile, so it seems like a number of you are using it. You use Rachel, the career profile. Mike, you're using supplemental housing assessment. Okay. Crystal, a biopsychosocial. That might be more common at a mental health or community organization, so it probably depends on what type of organization you work for. There's so much variation. Stephen, also biopsychosocial, focused on substance use disorder. Okay. So JMS, a needs assessment, right? And so thinking about what type of needs assessment, is that a rehab focus, kind of on multidimensional? There's so many different ways people are being assessed. And thank you so much for sharing the different types of assessments. So JMS, it's housing focused. Okay, yeah, so some of these are housing focused, some are more job focused, and some people are saying biopsychosocial, it's all different spheres. And what we're gonna talk about with best practice is to have this broad-based assessment of all these different areas of people's lives beyond just career or housing, in part because we're going to talk about areas of emotional health, social health, they impact housing and occupation. And so it's important to have that multidimensional assessment. So Sharon, which career profile? There's a standard form in Washington State. If anybody actually has a link to an example that you can share with Sharon, that would be very helpful. I'm not in Washington State and we don't have a career profile, but I've been told. So if anybody would like to share that, I really appreciate that. So first to the Amer group assessment. We're not going to talk much about this. It is standard, it's uniform, it's called the uniform assessment. And the main goal of it is to establish medical necessity. And this is absolutely what Amer group uses as the prior authorizer. The third party authorizer for the service needs to know that the person has medical necessity that fits the requirements of this program for Medicaid. And so what is required is both a health need and a risk factor. They're slightly different for supportive housing and supported employment. But there is some overlap. And so some examples I had that fit for both are a need for a health need, a need for mental health improvement, stabilization, and prevention. So for example, if somebody is at risk, and we'll talk about this with risk factors for hospitalization, rehospitalization, that could be a concern around mental illness. Also, activities of daily living, a concern that somebody can't live independently, or for example, find or keep a job, or also substance use disorder treatment. And then risk factors at risk for deterioration of mental illness or substance use, dysfunction of role performance, frequent or long institutional contacts. So again, being concerned that somebody can't keep a role, find a job, get a job, stay housed, and at risk for institutional contacts, whether that be inpatient hospitalization or frequent outpatient. So, and thank you for people in the chat sharing resources. I appreciate that, absolutely. So what I will ask is, what's a common health need or risk factor for your foundational community supports clients? What are things that you often see based on this, or if you're filling out the Amer group assessment, what do you often see? What types of issues in terms of a health need that people have, or a risk factor, what you're concerned about happening to somebody? So if you just want to take a moment to do that. Oh, thank you. Look at that. Thank you, Rachel. Excellent. So for those of you who want the career file, it is in the chat. So Bernadette, stabilization, absolutely. So mental health stabilization. So that could be around medication, that could be around treatment and symptoms, right? So lots of different things around kind of stabilizing mental health, symptoms, things like that. So JMS, mental health stabilization and or substance use disorder. Okay, so focusing on mental health and substance use disorder. Sonia, housing, medical needs, improvement, stabilization, chronic illness. Sarah, substance use disorder and mental health. Yeah, so a lot of these issues and a lot of dual diagnosed substance use and mental illness, in part because, right, substance use is often a way to, a coping strategy for symptoms. So Mike, isolation, lack of social support. Yeah, so thinking about, you know, daily life, being able to perform in roles, concerns about lack of social supports and social isolation, especially for somebody who may need support that doesn't have their own transportation, things like that, absolutely. And especially during COVID with isolation, I'm sure that's heightening things. Ashley, all of the above, substance use, mental health, and housing. Yeah, so a variety of different issues, but there's a lot of commonalities that are happening. And so these are required. And so the reason we're seeing commonalities is that there are only so many health needs and risk factors for foundational community supports, but people are individuals, right? Based on where they live, their experiences, they have very different needs, strengths and barriers that they're going to be facing, but a lot of the same combination of concerns around mental illness and substance use, absolutely. Yeah, and Mike, substance use being a maladaptive coping mechanism for the lack of connection, absolutely. And so a lot of things, and I'll give an example of somebody with hoarding, a lot of these things have to do with ways in which people are coping from Yeah, isolation, symptoms of mental illness, absolutely. And it is important to think about those things as ways that people are trying to cope. So I really appreciate you bringing that up. Thank you, Mike. So that's the Amer group assessment. Again, I put the links there. There is information for those of you who aren't so familiar with them. I highly recommend taking a look. So the comprehensive assessment, as I mentioned, there is no standard assessment that happens in foundational community supports, but it is required that a comprehensive assessment happens for both supportive housing and supported employment. And so what we're going to talk about is best practices, again, because there isn't a standard. And so these are things to think about while assessing. And again, I'm going to share a tool a little bit later to use while assessing. I'm going to just list what they are, and then we'll go through them in depth. Oh, no. That's not the order of things. First, I'm going to talk about what a comprehensive assessment is and then best practices. Oh my goodness. So what a comprehensive assessment does is it explores current and past experiences and interests, and it's a deeper dive. So I mentioned that the Amer group assessment is a lot of making sure you meet certain qualifications. What are your strengths? What are your barriers? It's kind of check boxes. What's your income? Do you have Medicaid? Like those type of things. The comprehensive assessment is this deeper dive, and it is trying to get at people's past and present situations, experiences to learn more about them, which is where valued life roles is a good conversation for a comprehensive assessment, where you want people to tell you about themselves. And so this is an opportunity to learn about somebody and learn about somebody in a way that you can see what are needs in their lives, what are their strengths, and how can you help them move forward. And just having a checkbox is not going to, a grid of checkboxes is not really going to help personalize those services and really get what's motivating somebody and what's going to help them. And what should happen at the end of the comprehensive assessment is identifying goals for the individualized service plan. And so the goal is to learn enough in this process to be able to have the person identify what they want to work on and then move to what services will actually be provided. So this all sounds good in theory, but there's a lot of incomplete and poor assessments that happen, right? That don't include everyone's historical information, that is maybe not good in terms of depth, right? So maybe the person gives one-word answers, right? There, you know, it's technically complete, but it's kind of poor in terms of its level of, I like to think about like thickness and like the depth that it goes into. So why do you think a lot of assessments might be kind of incomplete, not include some historical information? A lot of times trauma might be asked about in assessments, but isn't really talked about or talked about fully. What are some reasons why it might be hard to get a good assessment, or why you have a lot of incomplete or poor assessments that happen? Not just in FCS, just generally. What are some reasons for this, you might think? Time, yes, absolutely. Asking, 50 questions over 3 hours, exhausting, right? And people might just want to be done. A lack of trust, Moira, absolutely. Client might feel uncomfortable with the person, 100%. This is happening at the beginning of services. Yeah, can be really, really challenging. There's a lot of questions. It can be a detour, right? You're kind of trying to redirect people, but these questions take them in one direction, but then it's like, okay, we've assessed that. Let's move on to the next. That can be really hard for people to get into something and then move on to something else. Harrison, how we frame the question on the assessment, right? How are you asking the question? Does it make sense? We talked about just if you say, hey, what are your valued life roles? Somebody like, what are my valued life roles? A lot of times it's the way that it's being asked. Is it understandable? Are you modeling or giving an example of the type of thing you're looking for without telling them exactly what you want, of course, because you want them to be able to answer it. A lack of lacking an emotional history. Angela, Rebecca, the first meeting and rapport hasn't been established for the client to open up, feeling overwhelmed, had not enough sleep or food. Absolutely, the conditions under which the person's doing the assessment. Trust, fatigue, telling and retelling their story. Absolutely, we're going to talk about this. The idea that like this might not be the only program they're in, the only assessment that they've done recently. If they're starting a bunch of services, a partial program, lots of things, it might be very overwhelming to tell the same stories. And because there's so much turnover and assessments need to be redone, it's possible they've done the assessment 6 months before with somebody else, right? And you're like, oh, I'd really like to hear it from you. And they're like, I already told you that. I already told someone else that. And maybe you'll not be here in 6 months. So yeah, all those kind of factors. It's long, it's a lot of questions. Renee, a client is looking for an immediate solution. If they're homeless, they want housing, not to do an assessment. Yeah, it can feel, and this came up last time in terms of for people who are really on the edge in terms of being unhoused, needing immediate services, the idea of what's going to happen in 6 months, that feels too long. Absolutely. So thank you for bringing that up. Frustration and anger, telling the story can be difficult, Crystal. Yeah. So thank you so much. These are absolutely true things. And it's also important because of the type of service this is and because of the amount of planning that needs to go in, as I mentioned, of what Medicaid will pay for. It's not ideal to have to do these assessments so early, but it's what's required of the program, and the assessments can be updated as new information comes out, and often agencies have procedures for updating because people do disclose historical information, new things happen. So the process and timeline I know is different for all agencies, but it is important to think about how these documents can be updated. So because there's so many challenges, and thank you, people just, I knew that was the right question to ask because the flood of, oh my goodness, it's really hard to have a good assessment. I wanted to share some best practices to think about how to, you can't fix all these things and these aren't going to be magic bullets to fix these things. But in order to think about ways to frame the assessment, ways to think about asking questions, and ways to think about what are other sources of information beyond client self-report. So again, we're going to go through each of these in depth. I'm just going to give you an overview now. So including all sources of information when doing the assessment beyond just client self-report, being collaborative with the client and thinking about this not of I'm doing the assessment, what we are doing an assessment, and thinking about ways in which collaboration can happen. A focus on wellness over deficit, because again, if people are coming in for services, it can be like, oh, what do you need? As opposed to thinking about, you know, what the goal is, which is why it's so important that these are goal-focused services, because the goal is not to like get rid of things, but to think about how the person can be more, like healthier in a lot of different areas and not necessarily about deficits that they have, even though those deficits are absolutely important in the assessment process. And also to be strengths focused when identifying unmet needs. And we're going to talk quite a bit about unmet needs today. And unmet needs are those areas in which people need support. And when Emily talks next week about knowledge, skills, and resources, those are categories of kind of unmet needs, to know things, to be able to do things, to be able to have things. And so that we're going to get into more next week, but this framework of unmet needs, I think, is important. So we're going to go through each of these in depth. So best practice one is to include all available information. So feedback that providers in New Jersey that I've gotten is that what happens is assessments often include mostly client self-report, right? So the assessment are questions for the client. And so what often happens is their responses are most of what's included. However, there are times for a variety of the reasons you said, right? Their situation in terms of fatigue, sleep, sometimes because you know, I don't remember things to say, right? Or there are things that people don't want to share, right? And so there's a lot of reasons why it might be hard to only include client self-report. And so there are other sources to include. And in fact, Medicaid auditors are going to be looking for other sources. And so, for example, referral and intake information could be a very good source of information, whether they're coming from a hospital, whether they're coming from another program, from community referral, maybe a community organization, or from within your agency. There's information, right? There could be previous assessments, there can be documents that come over with the person, and that includes good information, especially historical information, and it's a good place to start. Letting the person know where the information is coming from, not just that you know things, right? Oh, I see in your assessment, your intake information that you mentioned this, you know, can we talk about this? Or that you were referred from this agency. How did you come to be at that agency? Another source is the Amer group assessment. I mentioned that the Amer group assessment is mostly checkboxes for strengths and other things or barriers, but it's a good place to start. And so, for example, if somebody has, and you may do the assessment, but some of you mentioned you don't do both parts of the assessment. So if somebody else did the Amer group assessment, or you did, and somebody lists a barrier of transportation, and they say they lack personal transportation, that's a great place to start to ask more questions, especially if they need transportation for interviews, for jobs. So that's a great source of information to flesh out those kind of check boxes where you think it's important. Another good source of information is staff observation. And thinking about if you have a situation where somebody is telling you something that's, against what staff has seen. So for example, if you ask somebody about substance use or alcohol consumption and somebody says, I haven't drunk anything this week, but you see empty bottles, staff has said that they've seen people intoxicated or smelled alcohol on them, right? What do you do? Like, what would you do in that situation? If somebody wants to put in the chat, like what would you do in that situation in terms of an assessment? If somebody's telling you something that you've observed something different that you can see evidence of, what would you do on the assessment? Well, while I'm giving people an opportunity to respond, this tension between staff observation and client self-report is really important. And so thinking about the client reports to not have used, to not have consumed alcohol in the last week. However, I observed empty containers and other staff working with the person observed the person inebriated or smelling like alcohol. Right. And so nothing's perfect. Like, we don't know, maybe those empty bottles are somebody else's, but you're saying what you're observing. Right. And so you're not saying that the person is wrong. You're saying that the person is telling a specific story from their perspective, and you're taking in observations, things they told you in the past, things that you're seeing, things that other staff see. And so that's really important to include that in the assessment process. So thinking about, for all of you, what is a helpful source of information in terms of doing an assessment for those of you who currently do the assessment or have done the assessment in the past? Are any of these sources, is there something I didn't talk about that is a good source for getting information from the assessment? Something to think about. So if people want to respond, I'm going to keep doing looking at the chat and keep it moving. Referring from a housing case manager, mental health therapist. Okay, so other professionals working with the person, absolutely. And that's great in terms of whether they're with you at your agency or somewhere else, absolutely great source of information. Other case managers they've worked with, yeah. And you could say, you know, case manager who's also working on the case in terms of documentation, you know, reports seeing this, having this, caregivers, informal supports, absolutely. All of those are good pieces of information to include on assessments. Thank you, Roxanne. Lorena and Crystal. I'm sorry if I'm mispronouncing anybody's name. So in terms of client self-report is important, and it's a big part of the assessment. And we just wanted to give you a framework for thinking about the type of questions asked. And so, as I mentioned, the Amer Group Uniform Assessment is mostly, you know, what is your income? What is this? It's a lot of check boxes. It's a lot of closed-ended questions. And closed-ended questions are questions that either encourage you to have a yes/no response, or questions that kind of very much narrow the type of response you would give. What year did this happen? Where do you live? What's your address? There isn't a lot of space for the type of response you would give. You're really telling people exactly what you want to know. However, in the comprehensive assessment, because it's a deeper dive, you want more powerful or open-ended questions, questions that allow people to take it maybe in an unexpected direction, talk about something you didn't expect, or to think about what are stories, what are experiences, because you want that depth in terms of responses. And the type of question you ask is very much going to help that. So questions of why or how, like process, or the reasoning behind something, or tell me more about this. Those are all ways to frame things in a way that give people the opportunity to respond in the way that makes the most sense to them. So you're opening the conversation, opening the door, which is important in the assessment process. So thinking about these open-ended questions as being powerful. Best practice 2 is to be collaborative with the client. And so simply, there's a principle in shared decision-making that comes from the medical field, that information and decisions should be shared between a client and provider, right? So there's nothing that's being written on the assessment that the person can't see. The process of doing a plan, all of that is visible and takes in what the client is saying and takes that seriously. What is a goal? What are services they think would be helpful? All those things are done in collaboration. And the outcomes that's been found in medicine, as in addition to other areas like mental health and substance use, is that client collaboration increases confidence and involvement, that people are more involved in services that they had some process in determining, which makes sense. When you're involved in things, planning things, you're more invested in them, right? So this is a general theory that that the assessment process should be collaborative and as collaborative as possible. Again, if people are not interested and not invested, that's a huge problem, right? Again, if somebody is worried about where they're going to sleep, immediate services, if somebody is worried in terms of feeling that they can't trust somebody, or it's just kind of the space they're in, or symptoms, it's going to be hard to have that collaboration. So I absolutely want to put those caveats there. And I'm going to ask, how have you involved a client in the assessment process? So Angela, you put, it builds a lot of trust, collaboration, absolutely. But is there any way you've involved clients? We've had providers here share that they give clients the comprehensive assessment, a copy of it in advance, so that people can look at the questions, do some planning, and think about how they'll respond. Not for everybody, for certain people who have showed an interest and are interested in the goal planning process, that can be helpful to feel like they're part of this process, right? It's not just things being thrown at them, but they can actually see what's going to be asked on the assessment and prepare in a way for it. Is there any other way that you found to involve people in the process? Any choices you've given people? So for example, choices around when the assessment happens. Okay, so Sarah, when you meet over Zoom, I show my screen with them and we read the questions. Absolutely, that is absolutely a way. And that's a nice use of technology to be able to share, what the questions are, what's being written. Thank you for sharing that, Sarah. Any other way using technology or not? Maybe just one more example of involving people in the process. Thank you for sharing that, Sarah. So Rebecca, being as flexible as to where the assessment happens. Yeah, where the assessment happens, is it broken up, right? Do people only want to do it in half an hour or hour chunks, right? How often? Is it over 1 week? Is it broken up? The place they feel most comfortable. Absolutely. So asking things like that in terms of what's best. Do you want it in your home? Do you want it somewhere in the community, in our offices? Right? What makes the most sense? Absolutely. So Michael explained the reason for the assessment. Absolutely. Acknowledge it's not the most fun and sprinkling in questions with the conversation. That is wonderful. Thank you so much for that, Michael. And I think that idea, and I try to do this of the rationale of why we talk about things when I do training or teaching, why we're reading things, why we're doing things, right? Why we're using the golden thread. All those things I think are important for people understanding that yes, documentation is not the most fun, but thinking about the benefits of it and trying to build that, that connection to it, absolutely. And I think some empathy for assessments are hard, like whether it's a school any type of assessment is challenging, right? And demands a lot from people. So acknowledging that, absolutely. Thank you all for sharing. Ooh. Best practice 3, a focus on wellness. And so we talked about the goals of community integration, quality of life, and recovery, and generally thinking about wellness for all of those things, whether it's integrating into community, having a good quality of life, or thinking about recovery goals. All those things are about thinking about wellness. And the Substance Abuse and Mental Health Administration, SAMHSA, they have a wellness initiative for both mental health and substance use. And so I'm just going to we're going to talk about the 8 dimensions of wellness broadly, and these are important for a multidimensional assessment for thinking not just about occupational wellness or housing wellness, but thinking more broadly about all these forms of wellness that may be impacting people that you're working with. So I'm going to play this. It's like a 2.5-minute video just about the 8 dimensions of wellness and the wellness initiative. So I just want to respond. A couple more people put in the chat before I do the video, just to respect that people are writing things. So Nicole, you had a woman's baby you held a woman's baby during an appointment, which lessened her stress. Oh, that's really beautiful. Like in terms of seeing like, oh, she needed a break and having that, giving her more chance to focus. Thank you for sharing that. Mike, you let your client choose how regularly they want to review the questions on the assessment, see if the answers are changing and more to measure progress. Absolutely. So maybe going back to things and not just having it be high stakes every 6 months or once a year, but thinking about how to let people go back to things to not feel like things are set in stone. Bernadette, in our organization, we ask parents if they're going to access for their own services if they want their child's wise team member to sit with them during the assessment. Yeah, so asking if they want other people to be present, that's a really nice thing, thinking about the different services that are connected, and if there are other people maybe they feel comfortable with and want involved in the process. Yeah, thank you. Thank you all for sharing those things. And so in thinking about areas to discuss, this idea of wellness and about health in all these different areas, 8 that we'll talk about, which I'd like to point out doesn't so much focus on culture and identity or sexuality. So missing from this model, as well as some other things are missing, but this is definitely a good start for thinking about wellness. So this is going to be a 2.5-minute video, and then we're going to go through each dimension.
The Substance Abuse and Mental Health Services Administration, or SAMHSA, created the Wellness Initiative to help people with mental and/or substance use disorders, and all people, live longer, healthier lives by focusing on the 8 dimensions of wellness that connect all aspects of behavioral health. Improving wellness by taking action on each of these dimensions addresses early mortality from treatable and preventable conditions. Embracing wellness is about life and living, and becoming the healthiest you possible. Listen to your feelings, express them to people you trust, and maintain a positive outlook. Make it a point to understand your finances, establish good financial habits, and plan for the future. A sense of belonging and a reliable support system help during difficult times. Make at least one social connection daily. Seek advice from peers or support groups, and create healthy friendships. Enhancing your connection to self, nature, and others brings balance and peace to your life. Take time to discover what values and beliefs are most important to you. Look for satisfaction from things you're passionate about, whether it is through work, school, or volunteering. Reduce your risk of many illnesses by increasing activity levels according to your abilities, getting restful sleep at night, choosing healthy foods, and exploring outdoors to reduce stress and increase energy levels. Be a lifelong learner by expanding your knowledge and finding creative outlets that stimulate your mind and sense of curiosity. Be open to new ideas, insights, and wisdom. A positive environment has a calming effect. Find surroundings that encourage good physical and mental health, and where you also feel safe. At SAMHSA, we envision a future in which people with mental and/or substance use disorders, and all people, pursue optimal health, happiness, recovery, and a full and satisfying life in the community.
So a full and satisfying life in the community, right? That's a lot in thinking about rehabilitation services, right? Community integration, having a high quality of life. So SAMHSA has identified these as 8 areas to focus on. They were a little bit broad in terms of thinking about them and not super specific, but we're going to go into a little bit more detail with them. It's also important to think about, for those of you doing work in supported employment, occupational wellness, right, might be the main focus of your work. And for people in supportive housing, it might be environmental or housing wellness. But we're going to talk about how these are interdependent and how a lot of times other areas of life are important to think about stabilizing occupational wellness and environmental wellness. So, that is a great question for people in Washington State. So Mike put in the chat, what are social wellness resources in Washington State? And so we're actually going to talk about that in a moment because we're going to go through each of these. But does anybody have a place that they go to? I know some people have suggested, for example, meetup, things like that. Sometimes if people are more interested in certain types of meetings, like for example, some people with animals, with PETA or the Audubon Society in terms of, so it really depends on the type of interest that somebody has. So sometimes there are these larger things like meetup around interest, but other things. So if anybody has something for Mike, because I'm not located in Washington State, so if there's anything Washington State, I'll take anything. Okay, excellent. So if anybody wants to respond to that in the chat, it's much appreciated. So for the 8 dimensions of wellness, so we're going to go through each and just think about what are types of, it's hard to find things around there. Okay, so we have some responses there in the chat from Mike. I appreciate that. So what are things that people might be working on around emotional wellness? People that you're working with, what are some areas that people might be trying to improve for folks that you're working with? You can definitely put it. Ooh. Okay, we're going back and forth. So I'm looking too much at the chat. I'm going to focus on this. So emotional, and you can put in as I'm going through these, if there's anything that comes up for you that you're thinking about in these areas. So emotional wellness, that might be directly related to somebody's symptoms. It might be related to medication, relationship with a psychiatrist, but it also might be related to, for example, coping mechanisms. It might be related to thinking about meditation and things like that, and about balance in people's kind of emotional well-being. So anything like that, it can be very related to symptoms or medication, but it can absolutely be more broad. So Beth, working on trauma, Angela, celebrate recovery, hurts, habits, and hangups. Yeah, these are all great things in terms of thinking about emotional wellness and supports for emotional wellness. For financial wellness, so what are some things you might work on around financial wellness? Right? So it could be things around income and benefits, right? So it could just be around making sure people have income or benefits that they need. It could be around savings. It could be around debt remediation. Who here is working with somebody who has debt, right? It could be working on past debt and a basic budgeting. Absolutely. So past debt, really important. It could be around utilities. It could be around past apartments, things like that. Super, super important. So everything from income to debt to budgeting, that's absolutely to promote financial wellness. Then we have social wellness, as Mike brought up. So what are some ways to work on and some areas people might want to work on things with social wellness? So this might be areas, for example, it could be around making new friends. Absolutely, so it could be friends. It could be completely individualized, meeting people, doing things at home in the community remotely, but it could also be social groups. So it could be, for example, oh, thank you for sharing that resource, Mike. It could be, for example, taking part in a local shelter, volunteer activities. That could be anything in terms of getting out, meeting people. It could be formal. When I first moved to New York City, I did a lot of meetup groups to meet people with similar interests around debating, things like that. So absolutely, all those type of interactions that can be personal, can be familial, it can be kind of a social, about an association that you have, an identity you have, all those things social. Spiritual wellness, this could be membership in a formal religious community, participating in it, or it could be meditation, something like that that you see as a relationship between yourself and nature or a higher power, however that is defined for people. So Ashley, you had speaking to others. Some people are used to being overlooked for social wellness. Absolutely. So those basic social skills, right? How do you engage with people? How do you make sure that you're able to start conversations, end conversations? So those conversational skills, absolutely. So Michael, you encourage clients to join support groups, not just for issues we talked about, but a great way to make friends and without worrying about stigma. Yeah, support groups are absolutely, that's a great place. And I know a lot of support groups have moved online or were online to begin with. And so that's absolutely a great place to begin. So it could be an interest group or more of a support group, absolutely. So occupational, right? This could be around occupational training, readiness to work, soft skills, hard skills, the interview process, actual jobs, job retention skills, all of those things included in occupational wellness. Ooh. Physical wellness, big area, a big area of interest, very important. So as all these areas are important, so what are some areas in terms of physical wellness? You can think specifically about preventative medicine, about physical health in that way of kind of getting healthcare. Mike, diet and exercise, absolutely. So nutrition, movement, all those things, right? So thinking about resources, thinking about skills, thinking about knowledge around nutrition, how to actually have skills if people are working on cooking or preparing certain or storing certain types of food, and then actually the resources to get those things, absolutely. Connection to insurance, establishing a medical home. Yeah, so thinking about actually accessing resources, which could be through Medicaid, right? So this could be about their insurance, right? Things like that, all around physical health. Intellectual, these could be actual classes that people are taking, a program that people are working toward training, or it could be just learning skills. And so thinking about people learning knitting skills, learning other types of ways to make things or do things, all of those are about intellectual wellness. Literacy skills, numeracy skills, all of those things. It doesn't have to be necessarily finishing a GED program or working towards credits. But Angela, absolutely, a GED program, an ELL program for somebody who's an English language learner. So working towards English language literacy, being able to write, all those type of things, absolutely intellectual wellness. And then environmental wellness. So thinking about housing. And Ashley, you read my mind with environmental wellness, Ashley. Libraries are an absolute, like those are resource in the community. So all those community resources, and if anybody can think of a different type of resource, and Ashley, you talked about it in terms of crafts to workspace communication. Yeah, I love going to public libraries. I'm a big proponent of public libraries, not just to be able to check out books, but they often have a lot of programs, access to computers, to printers. Absolutely, libraries, amazing community resources. So also in terms of environmental wellness, this is your environment. So this is everything from transportation to libraries, to public parks, to your apartment. This is a huge area, kind of everything in your environment. So, and if you want to put in the chat areas of environmental wellness, things you might want to work on, again, housing issues, finding an apartment, keeping an apartment, finding local businesses with access to Wi-Fi. Absolutely, if you don't have Wi-Fi at home, finding that access really important. Some public parks, New York City, all the public parks have Wi-Fi, right? So certain cities or places have Wi-Fi, so learning those type of resources. COVID, there's a lot of free webinars on history, tours, art. Yeah, so resources in the community. If people are feeling isolated, are there things that people can safely do? Is it, whether it's online, if they can access it at the library, or if they have some type of personal device to be able to access that at home? Absolutely, thinking about those resources, right? To maybe cut through, and thank you for bringing that up, Francine, because I think this builds on the idea of interdependence, right? So if you're getting a resource in the community, that might help with your social isolation. And so these are absolutely related. So thinking about integrating into the community is helping emotional wellness, social wellness, maybe spiritual wellness, if there's, for example, a religious community you want to be a part of. So all of these things are absolutely related. So Angela, is your apartment or housing environment set up positively as a happy place? Yeah, so the setup of your environment, right? What's in it? Is it stable? All those things, resources, thinking about knowledge about those things, how to set up a place to be kind of able to be cleaned, able to be a safe, calming environment to be in, absolutely. Yes, so one activity can cross several dimensions. The question is, what is it that's core to the person? Is it really about the environment, or is it really, because you might be working on a budgeting goal that's really, and you might be learning budgeting skills, but it's really for social interactions, because the goal of doing the budget is to be able to do something social. And so the question is, what is the person's end idea? Is it more social, or is it more financial, right? Is the goal to be financially independent, or is the goal to have money to do something social or something intellectual, right? And so while these cross-cut, there's usually one dominant thing that the person wants to work on, and you can only find that out from the person. So that is an excellent point. Oh, Feng Shui, thank you, Mike, yeah. Absolutely, different ways to conceptualize that kind of calming and safe environment of the home. So I think I have another poll for you, absolutely, to be interactive. Okay, so I'm going to put this poll, and what I want you to do is to think about what the primary dimension of wellness for these two different situations. The first, a client with social distancing concerns using public transportation. So that kind of concern, what is the main area of wellness? And then a client stockpiling beyond their financial means during the pandemic. Is that emotional, financial, social, spiritual, occupational, physical, intellectual, environmental? There's no right answer, but I'd like to see what you all think, which is going to be inflected by your experiences of the folks that you've worked with in your own life experiences. So good to get a sense of that. So I'm going to give it about 20 more seconds. So if people want to submit to this, I really appreciate it. Okay, and I'm going to close it in 5 more seconds. So anyone else who wants to submit, I suggest doing it now. So I'm going to close the poll now. So sharing results. So looking at the diversity of responses. So a client with social distancing concerns using public transport, it could be emotional, right? This could be that people feel depressed and isolated or anxious when they're doing it if they need to. It could be physical in terms of physical safety concerns of contracting COVID or something else. Or if they're working somewhere, even if you get, flu-like symptoms and it's not COVID, you might not be able to work, right? So those concerns. Also environmental, the actual use of the transportation. So again, this is going to depend on what the person sees as the primary concern. Oh, Kelly, you haven't been able to see either poll question. Is there a trick to seeing them? If somebody could respond, because my view is different. So if any of the participants want to respond to Kelly, that would be helpful. It should kind of pop up, but it might be a setting on your bar. So if somebody can respond to that, I appreciate it. So then in terms of a client stockpiling beyond their financial means during the pandemic, a lot of stockpiling happened. Which could put a financial strain, a space strain on people. So some people saw this as emotional, right? So issues around anxiety, other things, and wanting to have things, concerns about not having enough toilet paper, disinfectant, gloves, things like that. Financial, right? This could be a concern around budgeting and not having enough income to pay utilities and things like that, or environmental in terms of thinking about the physical environment. Is it possible they're stockpiling to the point where their apartment is becoming unusable? They can't pass a safety inspection, right? So thinking about, in addition, other people put intellectual, social, all those things could be at work. And I think for thinking about wellness is interdependent, as I've been talking about, but there is usually a primary concern that's driving the person, which is part of the reason assessment is important. It's hard to answer the questions I just asked because you don't know the person, right? I haven't given you enough information. So thinking about, right, can a client keep a job without access to dependable transportation? Probably not, right? And if the person's in walking distance to their job, maybe it does depend on the situation, but it's really hard if you don't have dependable transportation to hold a job, to do interviews, to be able to get to appointments, absolutely. And also, can a client maintain an apartment while symptomatic or depressed? It might be very hard, right? If they're feeling anxious, depressed, socially isolated, any of these other things. And so this is why foundational community supports, right, is broader than just, are you housed and do you have a job, right? Because we are complete people and these things absolutely relate to each other. So, and thank you, Angela and Ashley, for responding to Kelly in the chat. So any questions, any other questions before we move on from financial wellness, from, see where my mind is, from the 8 dimensions of wellness and thinking about wellness. Okay. So the 4th best practice is to be strengths-based in identifying unmet needs and unmet need. So unmet needs for clients in FCS are generally in the following areas. They're around housing and employment needs, and then around ADLs in areas of wellness related to housing and employment. Now, as I mentioned, there's so much that can go in these other dimensions, social, spiritual, emotional, all these other things that play into it, but the primary concern is around occupational and environmental wellness. But it's absolutely important to think about what is important to people, what's going to help them be stable in terms of housing and employment. So what are some common areas of unmet needs that you see in foundational community supports? Are there specific things around housing? Some people mentioned earlier, budgeting, debt, so anything specific that comes up commonly in terms of needs. We definitely hear here in New Jersey, budgeting, income, not having sufficient income, issues around tenant issues, landlord-tenant issues, neighbor issues, Those are absolutely important things around symptoms. So does anybody else want to share some common? Okay, income, clothing, transportation, absolutely. Thank you, Ashley. Really important issues, regardless of what state you're in. And very different depending on where you are in Washington State. Angela, food, absolutely. And COVID adds a new dimension to that, right? So not only having the income, the transportation, but just safely being able to get food, right? And for people who may have Rachel, transportation, people who might have issues around health and how to safely get that. Absolutely. And so with a beloved pet, Kathy, medications bill, yeah, all absolutely important things. And right, it depends on the person. Some of these cross-cut a lot of people you're working with, and some are very personal. Some people are absolutely not pet people. So, and thank you, things are still coming in. So I appreciate these responses. And thinking about, to work on unmet needs, the person needs to be interested, motivated, and have strengths related to that, right? People cannot be a blank slate in terms of things. They start with something. And this is why the focus on being strengths focused is that in areas of unmet need, you want to think about experiences and existing knowledge, skills, or resources. And so the thing is, again, people are not blank slates. They may have spent time as unhoused. They may have spent time in institutions, but they still have some foundation of experience, knowledge, skills, and thinking about building off of what's existing as opposed to kind of starting from scratch. And that's where the personalization and services happen. So a couple more. So Stephen, up here you have economic issues, being able to pay rent. There's programs for that. We have a lot of interpersonal conflict due to the stress of the pandemic and the election. Yeah, absolutely. So situational issues in terms of unmet needs. Kelly, employment with a criminal history. Absolutely. We talked a little bit about this last week. Angela, transportation to get pet care, especially for a serious pet illness or surgery. Absolutely. And can be very, very expensive. In my family, a cat was hit by a car a few weeks ago and broke his hip, and the question is old, and the expense and all these things around surgery. We ended up not getting surgery for the cat. It's just very expensive, and he was old and concerned. So yeah, all these kind of issues, emotional wellness. Yeah, absolutely. So those are definite needs. So what are common areas, especially when it's a service animal? Absolutely. No service cats, they're not very useful. So, although they're quite lovely. So what are common strengths that you see? So we talked about some common unmet needs, but what are strengths that people have? And thinking about strengths as being not just for the exact situation, but as an unhoused person, as somebody who's maybe been institutionalized, been in a number of treatment programs, resilience, planning, resourcefulness, perseverance. Exactly. People, lived under very difficult conditions in a lot of ways. And there are absolutely experiences, knowledge, and skills that can be transferred. And thinking about people being unmotivated. Last week, somebody talked about how the motivation to be housed coming from what somebody misses, right? And thinking about motivation as a source of absolutely thinking spirituality, positive outlook, absolutely. And then also thinking about, are there skills that somebody's actually done? Evidence-based. Oh, thank you, Mike, for sharing that. VITA strength, evidence-based assessment that ranks your strengths. Wonderful, thank you. We're gonna talk about how to find strengths concretely next week with knowledge, skills, and resources, a form. Helping each other out, mutual aid, absolutely. Thank you, Stephen. Yeah, so we're going to talk about how to assess strengths, but thinking about those strengths really important in the assessment process. For purposes of time, I'm going to skip over Angela and move on to an assessment tool for keeping us on track in terms of timing. So we talked about best practices, multidimensional assessment, thinking about asking open-ended questions, all of these type of things in terms of best practices, again, to get the most complete assessment process possible. Knowing that it's probably going to be incomplete, needs to be updated, will depend on the relationship built with somebody, but thinking about how to get that assessment in multiple areas. Some of you said that you're using the career profile or a biopsychosocial assessment. This wellness dimension worksheet, which I'm going to put in the chat right now, which you can save, download, and we're going to ask you to use in a moment, is multidimensional. It goes through each of the 8 dimensions of wellness I talked about, and using scaling, it asks you, what do you feel now? How would you rate yourself now? What would you like to be in the future? And what is something you might want to work on? And so this is basically quite open-ended, and you can use this in order to assess somebody. And I'm just going to give you an example of a wellness dimension. So this is for occupational wellness. So this is personal satisfaction and enrichment from work. So first you ask the person to choose a value from 1 to 5, with 5 being the highest or most positive, 1 being the lowest of where they are now in a particular dimension, and a value of 1 to 5 with where they'd like to be, let's say in 6 months or a year, depending on how long your process is. And then explore, what does that current score mean to you? What could be done to improve their score if they wanted to? And after reviewing each dimension, so the sheet that I gave you has 8 different dimensions. What are 2 to 3 priority areas? What are areas that somebody really wants to improve? So if somebody has a score of 2 on occupational wellness and wants in a 6 months to be a 2, which is not an area, that's not really an area to focus on. But if somebody, for example, in emotional wellness is a 2, but really wants to be a 3 or a 4, and that to them means perhaps getting some coping skills, things like that, some resources maybe to a new psychiatrist, whatever that looks like for them, that's a place to focus. And then thinking about, what they would need to improve in order to get a higher score, and that being the foundation for what the goal is. So does anyone have any, were people able to open and download the wellness worksheet? We can respond affirmatively. Yes, Ashley, excellent. I'm very happy to hear that. So what we're going to do, Roxanne, thank you. So what Francine and I are going to do now is demonstrate using it, and then we're going to give you an opportunity to use it in breakout groups. So what I want you to do is to take a look at the sheet. We're going to use the example of occupational wellness, and Francine is going to ask me some questions. You're going to do the same in partners or groups of 3. But when you do it, I'm going to demonstrate doing it for myself, where I was about a year ago when I wasn't employed before I started my current job, my occupational wellness. We're going to ask that you do the same for yourself, not use a client, but actually something you feel comfortable talking about. So not something, for example, that there's a lot of trauma or deep emotional feelings, but an area you feel comfortable talking about. And you can pick any of the areas of wellness. I'll tell you that in a moment. But what I want you to think for me, as Francine's asking me these questions, is what is an unmet need I have? What is a strength I have? And what is a potential goal? Okay. So this is going to be a demonstration of using this sheet. And then we're going to give you an opportunity to do that yourselves. Okay. So.
Hi, Shelley. Thank you so much for agreeing to meet with me. And I would like to talk with you about your occupational wellness. Is that okay?
Yeah, absolutely.
Sure. So first, let's start with, how would you currently rate your level of occupational wellness? So think about a scale of 1 to 5, with 5 being the highest level of occupational wellness. Where would you rate yourself?
I think I rate myself at a 2. I'm not currently employed, and I just finished a program. And so I feel like I'm hopeful that I'll be employed, but I'm not currently. I'm volunteering at a basic needs organization doing clothing distribution, things like that. But yeah, I'm just in the process of looking for work.
So at what level of occupational wellness would you like to be in 6 months, and using the same scale, 1 to 5, with 5 being the highest level of wellness?
I mean, I'd like to be a 3, just basically I'm employed. And so I think like thinking about like getting to a level of being employed and being employed in an area that I was trained in. I just mentioned that I finished a graduate degree. So something in an area that I was studying around workforce training, something like that. That would definitely make me feel better about my occupational wellness.
Okay, so what would moving from a 2 to a 3 look like for you?
Definitely having a job. I think feeling like it wasn't a waste to go back to school, all those type of things. So I think having some increased confidence and feelings of doing something meaningful. Yeah.
Okay, so using your degree and doing something meaningful.
Mm-hmm.
So to improve your wellness, what type of work could you do?
I've been thinking about how I've been teaching and doing other things for the last couple of years, and I'd like to keep teaching and have that be part of my job. And also I really like interviewing and working with people. And so having that interaction, I was doing it in terms of research, but just interacting and working with people specifically around training and education. That's really important to me. However, I feel like it's been really stressful in terms of thinking about references and updating my CV or resume. And I've been out of the full-time workforce. I've just had a bunch of part-time jobs, and being in school for so long, it feels kind of daunting to explain that. And also just the searching for jobs and finding things and knowing where to move. I think it's important for me to be close to family and also use my skills, but there's so few jobs. The economy isn't great, so.
What would you need to do to find that job using your degree?
I mean, I would say, like I said, like, you know, references, it's really stressful for me to think about contacting people about references and knowing who to use. And also just thinking about applying, also being in grad school for 6 years, my clothing's pretty ratty, and thinking about like what I'll actually interview and things like that. So yeah.
Well, thank you very much.
Thank you. Oh, thank you, Ashley. I really appreciate that. Yeah. So I was living in Connecticut with my family about a year ago. I had just finished and did not know what to do. And I was working at, I was folding clothing and doing things between part and full time at an organization, looking and applying and not really sure what I was going to do. So what is an unmet need, a strength, or a potential goal? You can just answer one of those based on what I shared. You know, do you feel like you learned anything in terms of that? Very simple questions that Francine was asking me, but it did make me think. I wasn't exactly sure what I was going to say. It did make me think about, right, what is it that I actually want? What is it I actually need? And so some simple, clear questions, and that's just in one area of wellness, but definitely other things came up in terms of education, in terms of thinking about social interaction, asking references, having those, right? So other areas came up in terms of thinking about that. So anything's in terms of an unmet need I had, a strength, a potential goal, or any questions about the wellness worksheet. And I just want to put out a plug that the wellness worksheet, right, it can be used as a standalone sheet if it's something you want to explore more. It could be added in, the scaling could be added into an assessment you currently have. This could just be a way to think about asking questions on the assessment you currently have. So we're not saying you should definitely use this in any particular way, but it's just a way to think about asking questions and thinking multidimensionally about assessment. Okay. So I'm now going to give you the opportunity to practice using this in pairs or groups of 3. So I have an activity here for the wellness worksheet. So I'm going to put you in pairs or groups of 3. And what I'm going to do is ask you to practice using it. And I'm going to give you about 5 minutes each and then ask you to switch. So it's going to be about 10 minutes in breakout groups, either distributed into 2 or 3. And you're going to ask the person, kind of like Francine did. You can pick an area that somebody wants to talk to, and you're just going to ask those questions. Where are you now? Where would you like to be? It's all on the sheet. So I suggest that you open the sheet from, which is the activity in the chat box. Oh, the worksheet isn't coming up. Is anyone else having difficulty with the worksheet? I'll just try to open it while we're here. Okay, yours works. Okay, so hopefully Bernadette, the person that you're in the group, will be able to open it. But basically you're using the wellness worksheet. Oh, your agency's firewall won't let you access it. Well, hopefully you'll be in groups where people can. And so you're going to think about as using the assessment and thinking about an unmet need, a strength, and a potential goal. And this is a process towards working to what's an unmet need and what's a goal to work towards. So any questions about this? Again, have the wellness worksheet and the activity if you can. And it's going to be, again, a couple-minute conversation. If you're not able to finish, that's okay. You're just kind of practicing. I'll give you like a half time. So it's going to be about 10 minutes. And then you'll have time to time for both of you or all three of you to be able to do a little bit of it. But if you don't get to finish, that's okay. If your audio doesn't work, just use this yourself and try to do an evaluation you can write down for yourself. If your audio doesn't work, I would say come back. If you're alone in the room, I'm going to try to fix things quickly so that people aren't alone in rooms as quickly as I can. So, okay, so I'm going to put you in rooms in a moment. So this would be so I'm going to put you in rooms, and again, this is going to be for 10 minutes. I'll give you a 5-minute warning, and please let me know if anyone has any questions. So you should get invitations to rooms now. Okay, so if people can accept the invitations, that'd be great.
I did accept mine. I was in room 4, so I don't know if that helps you.
No, it does. I'll move somebody else. So again, if people can keep accepting those invitations, move this person to room 3. Okay, so there's 3 people in that room. Okay, so again, if people can join those rooms, I'm going to give it like another 30 seconds and I'll move people around to make sure nobody's on their own. So if people can join, if there's anybody who was in a room by themselves, 26. Oh, no one was in your room. Okay, so I'm going to try to move you to different rooms, Mike and Paula. So I'm doing that. I'm in the process of doing that right now. So, okay, so give me a moment. You should get an invitation to another room. Let's see. Okay, so room 17, I can move you to room 14. So, Paul, I'm going to move you to room 14. You should get an invitation that pops up. And then room 9. Mike, I'm going to move you to room 9. So you should get an invitation for that. Joy is by yourself. Room 7. Okay, if anybody else wants to be moved to a room with someone else, please let me know. Just put it in the chat. Let's know. So, Collis, I hope I'm pronouncing your name right. There should be an invitation to room 16 that should be on your Zoom bar. You didn't get an invite. I'm not sure what it looks like on your bars.
Oh, Kelly, bye. Oh, that did go quick. Bye.
Sorry about that. I know the feeling of getting sucked back into the main meeting. Oh, wonderful to see people's faces. Sorry if it was too short or felt like an eternity. So I'm glad that people were able to be in groups. So I just wanted to check in. How was using the wellness worksheet? How was it to identify an unmet need, strength, potential goal? So reactions to using the sheet, but then also thinking about, would you use this? How would you use it? Was it actually helpful to you? Yeah, so any type of reaction. Oh, you couldn't pull it up. Ashley, you would use this. I'm so sorry. Bernadette, I'm gonna try to, yeah, I'm gonna try to do something. Wait until the end. I'm gonna try to see if I can get you access to it. Maybe once I'm off Zoom, I'll have a better connection. Okay. I felt it was helpful. It's to say it out loud, to think of ideas. Yeah, I would use this with a client, Rachel. That's great to hear. You like using this, Rebecca. It helps guide the questions and outcomes with more introspection. Absolutely. This is the goal, to give people an opportunity to think, right, what would I need, right? Like what's going on with me and what would I need? It does give a great opportunity. Mindy, you don't think you would use this sheet? It's too scripted and the ranking is impersonal. Absolutely. And we have ranking in New Jersey, and some people hate the scaling, hate the ranking. It depends on the person, the clinician. Absolutely. Like, so if scaling doesn't work for you, doesn't work for your clients, that's not a great thing to use. This is just a suggestion of a type of question to ask. It's not for everybody, not for everybody's style. So I really appreciate you sharing that, Mindy. So Ashley, question, is this one page or is there more follow-up? Is it just one page or was there more follow-up questions? Otherwise it was great. So this is just one page. It's actually used within the Department of Psychiatric Rehabilitation for training purposes. And part of it was integrated, as I mentioned, scaling and the goal development into our comprehensive rehabilitation assessment. So this is actually very bare bones, and it's bare bones on purpose. And as you saw, Francine added more questions. And so this is to be individualized. So, right, so asking like, what would it take to do this? What would you need? What could be helpful? What are the things that you can personalize this in any way possible? But this is very bare bones. It's supposed to give you an idea using the scaling to have people compare kind of where they are and where they would like to be. And all the rest of it is kind of up to you. So that's a great point, Roxanne. More time would be nice, but it's helpful with a good layout. Okay, that's good. Ooh, lots of responses. Found it difficult ranking each dimension. I find ranking really hard for myself, so I absolutely appreciate you that, Janie. Oh, Ashley, thank you for uploading the wellness worksheet. Sonia, excited to use. Max, you liked the blend of peer goal setting with a little more structure. Yeah, thank you for sending that so much, Ashley. We changed scaling from numeric ranking to a picture, like a gas tank. Thank you so much for that, Greg. I like that. And having that idea, what visual works, because right, if you think about it, sometimes I think in percentages, that's easy, like top 20%, bottom 20% of experiences. So everybody has different things that work from that. So absolutely making this your own if you decide to use it, and maybe not the 1 to 5, but thinking about top quarter, bottom, whatever kind of works for the person, things like that. Reminds you of a wheel of life. Yeah, absolutely. Thinking about kind of people more complexly in these dimensions and kind of scrolling out into other areas. Shannon, you really like to help you zone in, to use active listening opportunities with social, very relevant to COVID. Liked it. Okay, wonderful. I'm hearing, oh, and thank you for sharing the Wheel of Life, Mike, for other people. So this is, again, we're going to give you an opportunity as the learning application to use this if you see fit. I really like the suggestions about using different ways to do the scaling, different kind of questions you can add into it. This is not the end all be all tool, but this is a way to think about asking in a more open-ended way and for people to collaborate in responding because, right, they're thinking, what would I need, right? And so that brings them more into the process rather than just thinking about, oh, I don't have this and more deficit. It is much more of a strengths-based approach for thinking about where I am and where I would like to be and what I would need. So it much more puts the person in an active role. And as people mentioned, more introspection. So I'm glad that that tool for some of you is helpful. And it's also good to know what doesn't work and what you don't want to use. So it's good to know if you're not a scaling type of person when you're doing an assessment, to know that about yourself. I'm not really a scaling person, but some people, some clients find it really, that concreteness of moving from this to that, really, really helpful for some people. Or whether it's a gas tank, you know, half empty, half full. We do live in a driving centric culture. So gas tank is a great way to think about that. So kind of pulling things together, I just wanted to think again about some of the challenges of assessment that we talked about earlier. So as we're talking about a worksheet like the wellness worksheet, thinking about what are some of the challenges of assessment. And so thinking about, it's not always an easy conversation, as people talked about, in terms of timing, in terms of the topics that are covered, but these are some things that I thought were important to kind of pull out of the assessment, because we talked so much about assessment today, to think about, first of all, a lot of times clients can think they either don't know about a goal or are afraid to acknowledge having a goal or have given up. And this is a little bit different than we've talked about before, in part because, right, the systems that people have been in as people with perhaps a serious and persistent mental illness, people with substance use disorder, perhaps people who are unhoused, have been unhoused, or have been in institutions, a lot of times they haven't been listened to, right? And so thinking about how services in an institution, very specifically for people with a serious and persistent mental illness, are not optional, right? You don't get to choose what type of treatment you have, right? And so thinking about the idea, the limitations of people, financial, but then also in terms of movement, in terms of choices around bodily autonomy, what one eats, what medication one takes, very, very limited. And so thinking about people being in situations where they haven't been listened to and can't make a lot of choices, it's really important to think about all of a sudden asking somebody for choices like this maybe doesn't feel authentic to them, or feels like they've survived by not thinking about these things. And so it's important to think about how this might be opening up something for some people that they're not prepared to talk about. Another thing is it can trigger feelings of disappointment, anger, frustration, and sadness. So the process of assessment, we talked about last week, recovery, in terms of when people are thinking about recovery and recovery goals, this requires that you reformulate. And this happens across people's lifespan, right? As we get older, we have more limited options in a lot of ways, right? Our life kind of, and in a lot of ways, we're choosing more things, but that kind of pulls us in certain directions, right? So maybe you can think about being an astronaut at 10, if you have the right vision, but you know, by the time you're 40, that's not possible, right? And so all of us have to reformulate all of the time, but sometimes because of substance use or mental illness, those reformulations are sometimes significant, right? And so while all of us are reformulating, thinking about the feelings of anger, disappointment, sadness at some of those reformulations, which can feel like it's not what life planned for us. But as many of us know, life is not what we, plan at different stages, and rolling with that is really important. But some of those big changes due to institutional contacts, being unhoused, can be really crushing. Also, people can be tired of being asked, what goal do you want to work on? Right? And so if people are in partial programs, other type of programs within your agency, and they're being asked these same questions over and over again, that can be really, really frustrating. And so in the same way, if you get asked the same question again and again, so this assessment process can feel incredibly frustrating. So some tips for assessment. So following the client's lead in conversation, and I think this has come up this week and last week in terms of the chat. So thinking about people's areas of interest, change, or progress, and even, for example, the physical environment somebody's in, what somebody's wearing, what somebody's talked about, all those things as starting places for thinking about different dimensions of wellness and different needs and strengths that somebody has. So just their physical self, the things that they've talked about as starting points for entry. And again, these things are very basic, just things to think about, and also thinking about motivation. So what change do they want to see when the goal is achieved? And I think the question that a couple of people asked around wellness being interdependent, the idea is like, what do they actually want to be different if an unmet need is met, right? Do they want, earlier it was determined like this idea of being accountable. What does that mean to them? Is that the thing that's driving them? Or is it more the idea that, being a worker is really important and contributing to something, like what is actually driving them, and what do they want to see if they're able to be housed, employed differently, have certain social interactions? So that's really important for thinking about. So another opportunity to share. So thinking about in terms of I shared an assessment tool, the wellness worksheet, as a way to kind of start a conversation. So what are questions or strategies that have been helpful for you that you might like to share in terms of starting an assessment? Because again, with all the challenges we've talked about, the idea to make something individual, collaborative, and person focused about them achieving things can be really challenging for the person to participate in based on previous experiences and other things like that. Oh, okay, wonderful. So does anyone have any places that you like to start that you might, because people have been sharing such great resources today with each other. And so is there a place that anybody likes to start, a question that you like to ask, a way that you like to talk about the assessment that's helpful? Some people, I can't remember who said it, but at the beginning, telling people like what the assessment is for, that's a wonderful strategy to thinking about starting an assessment, about some education about what it's for, what the process is going to look like. Is there any other way, strategies to doing assessment? Any questions you like to ask? Mike put focusing on balance and not on scaling for using the wheel of life that was put in the chat. So that's a way to focus things and to have questions thinking about balance in life as opposed to this kind of idea of full or empty, high or low. Absolutely. Any other ways that people like to or think about in terms of assessment, questions, strategies? So Ashley, you try to make people feel comfortable, let them know my goal, that you have a goal in the appointment, absolutely, and let them know that you want their input and they're in charge of the direction. Yeah, absolutely. So the idea is a lot of times people are like, what do you want from me? So starting with like, this is, right, this is my goal in being here, right? And this is the goal of this assessment. So not pretending that you don't have an interest, right? Because people know you're providing a service. And so acknowledging that, absolutely, that's wonderful, wonderful advice. So maybe we'll just look. So Mindy, I asked people to imagine their best life and how they'd see themselves getting there, reaffirming dreams. Okay, so starting from like a goal they have for themselves, you know, what would, you know, in 6 months, a year, 5 years, what would your ideal life look like? What would an ideal day look like? That's, I feel like the idea of asking people about what their average day looks like and what their ideal day would look like, that's a way to get into like the nitty gritty of what people do. Would they have a job? Would they live in a certain place? Who would they interact with? Absolutely. So Kelly, as a substance use disorder clinician, I've had the conversation at the beginning of the assessment appointment, having the patient inform me what they understand about the assessment and if they can share their perceptions of substance use. Yeah, so giving their own definitions of what substance use is to them. That's a wonderful way. So definitionally, I'm teaching this semester and we're talking about identity and culture and having people define like what it means to be a woman to them, what it means to be bisexual, right? So having people define things for themselves that have a loaded kind of context within our society and within just what does it mean to you? That's a wonderful suggestion, Kelly, having people self-define. So I want to thank everybody for sharing resources. So this is, again, we talked about the two-step assessment process. Hopefully the tool may be helpful for some of you, may inform some questions. So the goal of this entire process is to get to a goal or to get to 2 or 3 prioritized goals. And so the goal should be based on needs and skills to meet unmet needs and based on hopes, dreams, and aspirations. So Mindy, this idea of what is your aspiration, what does your ideal life look like, that's absolutely where goals come from. But it's also, right, goals come from what do you need to get needs met. So if you have transportation needs, if you have needs around certain income, like what goal do you have to be able to meet that need, right? Because those needs are going to inform the things to work on in conversation with these longer term aspirations. They're supported by motivation from valued life roles and strengths in areas of skills and resources. So again, unmet needs, aspirations are then being supported by valued life roles and strengths. And this is the basis for working what services are going to be provided on the individualized service plan, skills and resources. So thinking about where we are, the comprehensive assessment is leading to goal identification based on valued life roles, needs, and strengths, which are the things that we talked about today. So that's the process of the comprehensive assessment. What Emily Bands, my colleague, is going to talk about next Tuesday's training is knowledge, skills, and resources. So you have this general goal, which might be, for example, to find part-time employment, to find housing, to move housing, to increase income, whatever that goal is, and to identify what knowledge, skills, and resources are needed to achieve that goal. And so those knowledge, skills, and resources are steps towards goal achievement. And so we're going to talk about a process of breaking goals down into the necessary knowledge, skills, and resources, right? And thinking about what knowledge, skills, and resources somebody have is their strengths versus what's needed are their unmet needs. And then that's going to bring us to the individualized service plan in the following week for thinking about how to prioritize what knowledge, skills, and resources are needed. Those become objectives on the ISP and identify the related interventions. So how are you going to have people reach those steps? What staff interventions are needed? And so this is going to be our process over the next 2 weeks for thinking about how to get towards the services that are provided on an ISP. So does anyone have any questions? We just went over the assessment, which is getting towards a goal, where you can use tools in terms of powerful questions, different types of scaling, or thinking about balance, however that works for you, open-ended questions, getting towards goals, aspirations, unmet needs, and then that's going to bring us to breaking those down to understand what's actually needed to achieve those goals. So what I'm going to do now is I also, based on popular demand from earlier, I'm going to first put the training evaluation. It would be very good to know specifically about resources, the videos I showed, the wellness worksheet, things like that, what worked, what didn't work, using the breakout rooms, if it worked for you, if it didn't work, all those things are really helpful to know. Again, we have 4 more of these trainings and having this feedback is helpful. I'm also, again, going to put the contact form. So as I mentioned at the beginning, for those of you who weren't on, last week people asked around an optional contact form, and it's for people to share contact information where you work in Washington State, your contact information, anything you want to share about yourself for other participants to have if you'd like to be in contact. We're not going to moderate this at all. Once you fill out the form, you can download the spreadsheet or save it to your Google Docs if you have an account. So I'm going to put that there again. Again, it is completely optional. So the Google Doc, you would click on that if you want to if you want to fill in, and then the spreadsheet if you'd like to look at it. So again, you're sharing this with the people, and we ask that you not share this more broadly. It's really just for people in this group. Again, we're not moderating it, so please be respectful with it, but also it's for people to be in communication. You're also welcome to chat with each other. You can chat individually to a person if you want to, oh, I really appreciated your comments, here's my email address, those type of things. Absolutely, please share each other's email. You don't have to share it with everyone if you just want to share it individually. The chat feature does allow you to individually chat someone if there's somebody who shared a resource who you want to stay in touch with. So I definitely encourage that. I'm also doing a plug one more time for the evaluation. It is in the chat. If you could do that, it's incredibly helpful. So the learning application. So while you're doing the evaluation, we talked about the wellness worksheet. Now, it's entirely possible, like you said, the scaling doesn't work for you, but some of the questions are thinking about the wellness areas. You don't have to use it as is, but we're going to ask that you think about multidimensional wellness assessment, maybe an area you don't normally assess for. So if you're in an employment program, maybe thinking about something beyond occupational wellness, assessing a different area. Or if you're in a supportive housing program, thinking about an area beyond environmental wellness, to think about people kind of more interdimensionally. That sounds like it's interdimensional travel. I don't know why I said that. different dimensions of their wellness and different dimensions that can be helpful. So sorry, I'm trying to get the link while I'm saying this. So here is one more time the wellness worksheet. I highly recommend you save, download it if you can. I think Ashley put it in the chat if somebody wants to directly download it from the chat. Thank you so much, Ashley, again, for putting it there. Yeah, I see the thumbs up. Thank you. So after using it, again, you don't have to use the scaling, you can use something different, but generally having this discussion, where are you, where would you like to be, and what is an area, what would it look like to get there, and what's something you might want to work on. Think about, did you learn something about the person from using it? And do you have any questions or concerns actually using it in practice? I know some people had concerns about the scaling, but is there anything else in using it that came up that would make this difficult or challenging? Also, are you like, this doesn't really fit into our assessment process, we're much more focused on this? Like thinking about that, does it work, does it not work? Does thinking about other areas of assessment actually help you? Those are some things I would like you to think about when you're using it. So again, the wellness worksheet is there. Please save and open it. Please do the evaluation if you can. The next training next Tuesday is on individual service planning components. It'll be with my colleague, Emily Bands. So on the 17th, it's the same registration. I've been pushing reminders the same day. I think Emily's gonna do the same thing. So you should get a reminder. Again, it's 9:30 to 11:30 next Tuesday, and that's a picture of Emily, who you'll be meeting next Tuesday. So we have about 2 minutes left. If anyone has any questions, I'm happy to answer them. We have references at the end. Again, this is going to go out via the Washington State Healthcare Authority, hopefully this week. And so you'll get all of these things, but these are the references that we cited. So I just wanted to put this up there, but I'm absolutely happy to answer any questions. But if not, if you've done the evaluation, save the wellness worksheet, I will let you go and see you next Tuesday. So have a wonderful, wonderful week. Thank you. Really nice to see everyone.